What are the different surgical approaches? So the different surgical approaches in which the surgery may be done is either a posterior approach or an anterior approach or a combination. So let's talk about the posterior approach. So most common approach, it is the posterior approach for vast majority of the thoraco-lumbar fractures, unstable fractures with intact neurology, flexion, distraction injuries, trans fractures. Rotational and shear injuries also easily are reduced and stabilized via the posterior approach rather than an anterior approach. So whenever there are dislocations, whenever there are significant amount of rotation that is involved, facetal dislocations, and so these are the injuries which can be easily reduced and stabilized via just a posterior approach rather than going ahead anteriorly, because anteriorly becomes a bit morbid with respect to exposure and reaching the spine. Posterior pedicle screw fixation has shown to be a simple, familiar, reliable, and safe in regards to the achieving the reduction and also stabilization for most of the fractures, and it remains the most popular technique. So back in the days, anterior surgeries were done. Eventually that got shifted to posterior surgeries because of the ease, reliability, and also the pedicle screw constructed such that pedicle screw gives a 3 column purchase in the spine. So that basically has given a better preference or preferential surgery, that is a posterior surgery rather than the anterior surgery.